Welcome to Session 2 of the audio series Overcoming Social Anxiety, Step by Step. This is the beginning therapy tape of the audio series. We will begin the cognitive therapy first to give you the methods, strategies, and techniques that will begin to help us lessen and control social anxiety. Remember that cognitive means thinking or thinking processes. So with the strategies you are about to learn, you will gradually be changing the way you think, the way you perceive yourself and others, and the way you view the world around you. The objective is for you to see yourself and situations around you more accurately and more rationally than you do right now. We know that those of us with social anxiety many times blow a situation out of proportion. We catastrophize things and make mountains out of molehills. For example, I used to be very self-conscious when driving in my car. I wasn't afraid of driving or of traffic. I was afraid that passing motorists or people stopped at a traffic light next to me were staring at me and judging or making fun of me. Now I knew this was irrational and that it didn't make any sense. But nevertheless, I felt that people were doing that. And because I felt that way, my muscles tensed up, my self-consciousness increased, and I became more and more inhibited. I swallowed heavily and felt like I had done something wrong and was under inspection. I never turned and looked in the direction of another car because I was sure they would be staring back at me, and then I would really be anxious. So I just allowed the self-consciousness to fester and grow, tense me up, make me feel more inhibited, and eventually give me a headache. All because I believed something that was completely untrue, that people were staring at me in my car and making fun of me. I catastrophized my feelings and my perceptions, which were inaccurate perceptions, to heightened, exaggerated levels, and by then it was impossible to feel normal. After an incident like this, my inhibition and anxiety were so strong that I couldn't talk to anyone. I simply had no energy left. I was completely fatigued. Usually I had to make my way home and lay down. We also tend to take things too personally. If we hear someone laughing behind us, it's easy to suspect they're laughing at us, when almost all the time they haven't even noticed us at all, and they're laughing at something else entirely. I had this particular problem where I worked, at a junior high school. For many years while teaching, I was very quick to catch on to people laughing, because I always suspected they must be laughing at me. Rationally, I knew they were not, but it felt like they were making fun of me, or at least it was possible they were laughing at me. So many times I took this laughter personally, and it made me anxious, self-conscious, and hypervigilant. It also lowered my self-esteem. You can't think too realistically about yourself if a little laughter throws you off. I asked myself questions like, why are they laughing at me? Do I walk funny? Did I make a strange expression with my face? Maybe I tried to smile and couldn't smile all the way. They probably think I'm an idiot. Did they dislike what I said yesterday in that meeting? Do my clothes look funny? Maybe I don't know how to dress. Or are they laughing because I'm too afraid to come join them in the teacher's lounge? I bet they really talk about me in there. I'm probably the only teacher in the whole school who doesn't eat lunch in the teacher's lounge. They must think I'm really strange and weird. So I took laughter, comments, stares, and interpreted them all, personally, as being meant to hurt me in some way. Looking back, I can see this almost never happened. And when it did, it all related back to my anxiety and the limitations social anxiety put on my life. I exaggerated, catastrophized, and took everything too personally, thus seeing the world as a very negative place, and seeing other people as dangers I needed to avoid, because somehow they were going to hurt me, embarrass me, or humiliate me. I had a very low opinion of myself, and all of my catastrophizing and personalizing just made everything worse. I was in a vicious cycle and didn't know how to get out. The irrationality of this kind of thinking is what you are going to change. We will get started working on this today, on this very tape. Please remember consistency and persistence. You can't change old brain habits that have existed for many, many years overnight. Changing your thinking habits takes time and only starts to work as you consistently practice the methods on this tape. Remember, though, that you've made a positive start, so pat yourself on the back. This first step is usually the hardest step for anyone to take. To summarize so far, when we think about these real-life situations logically, we know our feelings about them can be irrational. The purpose of cognitive therapy is to catch this negative, irrational thinking and gradually turn it around into healthy, rational thoughts. No one method by itself can do this. That is why we will use many cognitive methods to get our negative thinking under control. We will use every method available to us so that we can continue to eradicate the vicious cycle of negative thinking, negative beliefs, and negative expectations that we've lived with for so long. Every time we put a dent in this automatic cycle of negative thinking, we're moving one step closer to being able to control it. As you begin, keep in mind again that it takes practice, persistence, patience, and time for the strategies to work. Do not expect the methods or strategies we will begin to use today to work for you today. As you continue to use them and work with them, and as you are persistent with them, they will not only become easier for you to do, but they will sink farther down into your brain and become stronger as well. In your booklet, look at the handout of the human brain. Notice that the top part, or gray part, called the cerebrum, is where we do our thinking, planning, and perceiving. We also call this part of the brain the cognitive brain. This is where the new strategies, methods, and concepts we learn will start to become automatic. The middle part of the brain, in white, is usually called the mid-region area. This is where the limbic system is located. This mid-region area is directly in the center of your brain and sits close to the top of your spinal column. This region of the brain, for our purposes, is known as the emotional brain. This is the part of the brain that controls all of our emotions. The negative ones we don't like, such as anxiety, fear, depression, irritation, frustration, and anger, but also the good emotions as well, such as peace, happiness, enjoyment, contentment, and serenity. Here is the key point. Because anxiety is an emotion, we have to reach the emotional brain with comprehensive cognitive behavioral therapy. Because if we can't reach the emotional brain and change our emotions, we will not have a chance at overcoming the emotion of anxiety. We know, however, that the more strategies we can use to reduce anxiety, to take the pressure off ourselves, and to think more clearly and rationally, allows us to make permanent, positive changes in the emotional brain. It is not enough to make changes in the cerebrum or the cognitive part of the brain. We must get farther down into the brain and change our beliefs, belief systems, feelings, and emotions. We must tap into the emotional brain to allow the therapy to be able to begin to permanently change our brain circuitry. And since we can no longer do lobotomies, thankfully, we have only one cognitive way of getting healthy, rational, therapeutic information down into the emotional brain, and that is through the 3 R's. Repetition, reinforcement, and reprogramming. The more your brain hears, sees, perceives, or is exposed to this positive therapy, the stronger the therapy becomes. The more you accept it, the more you believe it, and the more it turns into an emotion, a positive emotion which will begin to control and conquer the negative emotions we've dealt with for so many years. Let me give you an example to make this more clear. When you and I were young, we learned our ABCs by singing a song that was continually reinforced by our parents, teachers, friends, school, and relatives, so that even though we've been out of kindergarten for many, many years, we can still remember that ABC song. I would sing it for you right now, but since this is an anti-anxiety tape, I don't want to be accused of causing you more anxiety. The point is that the ABC song was repeated so many times in so many different ways that it reached down into our emotional brains, and we couldn't forget it now, even if we tried. That song you learned so long ago is still there. You still remember it. It is foundational. That is exactly what we plan to do with comprehensive cognitive behavioral therapy. Repetition, reinforcement, reprogramming. And at this stage, the greatest R is repetition. Now, just as in studying for a test, we need to approach the therapy wisely. Your brain takes in more information if you are calm, relaxed, and feeling okay. Thus, we want you to practice the therapy when you are relatively calm and relaxed so that it can get into your mind and slowly be dropped down into your emotional brain. If you are feeling upset, anxious, or frustrated, reading over your therapy handouts is not going to work very well, and very little of the information is going to reach your brain. So we need to approach the therapy from as calm and relaxed a vantage point as possible. Because it is important that you are relatively calm when you're beginning to learn the cognitive material, it is always best to be alone when you're going over and practicing the therapy. If you live with other people, find a 30-minute time period every day, 7 days a week, that you can close the door, be alone,